prize is almost mine.
Palantir is here to disrupt and make the institutions we partner with the very best in the world, and when it's necessary, to scare enemies and on occasion kill them. And we hope you're in favor of that. Kill our enemies. They're going to lead to increases in transparency, and by the way, increases in lethality. Deploy and use AI in a way where it changes your margins, it changes your go-to-market, it changes your ability to kill or take out adversaries in a much safer way with much lower costs. Anti-Semitism. Well, I love the idea of getting a drone and having light fentanyl-laced urine spraying on analysts who tried to screw us. The primary way to create peace in this world is to scare our adversaries when they wake up, when they go to bed, while they're seeing their mistress. Whatever they're doing, they're scared. The best thing that could happen to them is we will lead their coke dealers to their homes after they can't pay their bills. Go ahead, do your thing, we'll do our thing.
Imagine a company ran by that guy. That quickly became a central tool of the U.S. intelligence community. Palantir was founded in 2003, and by 2005, the CIA's venture arm, In-Q-Tel, was its only customer, using the fledgling platform to test counterterrorism software. Palantir says it launched in the intelligence and defense spaces by assisting the United States in counterterrorism investigations and operations. Gotham, the platform built for those missions, evolved into an AI-enabled system now used by U.S. military, intelligence, and law enforcement agencies. A tool that once helped fight terrorists now handles everything from battlefield targeting to supply chain optimization. By the early 2010s, Palantir's software had moved from war zones into American cities. Police departments adopted its predictive policing tools. The Los Angeles program, Operation Laser, used Palantir to generate lists of people deemed likely to commit crime. Immigration and Customs Enforcement, ICE, signed contracts that allowed near real-time tracking of migrants, which is a convoluted way of saying real-time tracking of you, since it's infinitely easier to track somebody who is actually in the system than it is to track an unknown, undocumented immigrant. In 2025, 13 former employees published a letter called The Scouring of the Shire. They said the company's original ethical guardrails had been violated and accused leaders of abandoning democratic values while supporting authoritarian data collection schemes. The letter warned that Palantir was building tools that would normalize surveillance and discrimination. Juan Sebastian Pinto, a former Palantir content strategist, described drawing kill chain diagrams used to orchestrate strikes. He warns that the same intelligence surveillance target acquisition, ISTAR, technologies are being deployed in the United States. Predator drones circling Los Angeles to track protesters and data dragnets that collect personal information from commercial and government sources. He fears Palantir software has already been used to track people based on protected speech. Cambridge Analytica whistleblower Christopher Wiley told a UK inquiry that senior Palantir employees accessed Facebook data used to profile 50 million American voters. Palantir initially denied involvement, but later admitted a staff member approached Cambridge Analytica in a personal capacity. When the British National Health Service considered granting Palantir a $330 million data platform contract, the British Medical Association passed a motion opposing it. Doctors pointed to Palantir's track record in discriminatory policing and said a firm tied to U.S. intelligence should not manage patient data. Unfortunately, the same cannot be said for America. Palantir has been deeply embedded into the entire medical industry for over a decade now in America. A company rooted in finding, tracking, and killing targets is now running our healthcare systems. Over roughly 20 years, Palantir has expanded from CIA alpha tests to contracts across U.S. defense, law enforcement, and even public health. Whistleblowers and critics suggest that the company's software has become an all-seeing eye that blurs the line between wartime surveillance and civilian life. The underlying message, a tool built to protect, can easily morph into an instrument of control and a weapon of death. We must scrutinize how these platforms are used and insist on their removal before they erode the freedoms they claim to defend.
Be scared and uncomfortable. More tomorrow than today.
I told you. Nowhere to hide.
Dr. Palantir.
Oh, good and organ donor.
Dr. Palantir.
We are going to need a ventilator for this one.
Code blue, room 305. Code blue, room
Dr.
305.
Palantir.
All doctors to the ER.
Palantir, your friendly neighborhood AI who knows more about you than you do, and also makes real-time decisions about who to kill, how to kill them, and where the killing takes place on the battlefield, or at your home if you live in Gaza, or if you live anywhere else, since Gaza was a successful kill chain training mission, allegedly. Remember the PCR test? You know, the one that the inventor of warned us that it is useless for virus detection. The same inventor who just happened to die mere weeks before the pandemic began. But at the same time, Palantir was shipping PCR tests around the world for the upcoming pandemic. Well, the PCR test wasn't about finding a virus. The data that was being sequenced was sent to GISAID and GSI databanks in addition to the CDC. It was a genomic harvesting operation to use AI to create tailored bioweapons based on your genes. AMA, AHS Protect, and the CDC partnered with Palantir, who developed a program called Tiberius, which was used for Operation Warp Speed that assigned people a threat risk score. It also has other functions. It's AI that has full access to Epic's EHR data. Epic is software used in every medical field for patient treatment coding, patient record management, billing, clinical decision support, and more. What Tiberius did was assign you a threat risk score. Like if you were following lockdown criteria, if you were actually distancing from people, based on data harvested from your smartphone, if you had been vaccinated, if you were masking, how obedient were you? That was your threat risk score. The second program developed by Palantir was Gotham, the AI kill chain program that was used within HHS Protect. It takes the threat risk score from Tiberius, and then it tells several AI decision-making processes, and then decides when and how and where to deploy the countermeasures against the threat, which is you, Through logistics and inventory management, it had already chosen the vaccine your hospital had in stock. If you were unfortunate, it had plenty of remdesivir and ventilators in stock to influence doctors and medical staff decisions. HHS Protect was created to monitor all that activity. If the hospitals didn't upload their data typically by noon local time, they would lose Medicare, Medicaid payments and face other possible penalties. They all complied. What is Palantir's Gotham kill chain? The kill chain refers to the step-by-step process used to identify, track, target, and destroy an enemy. The classic kill chain model, often called F2T2EA, stands for Find, Detect, and Locate Potential Targets, Fix, Pinpoint, and confirm the target's precise location, Track, monitor the target's movement or status, Target, decide to strike and select weapons/platforms, Engage, attack the target, Assess, evaluate the results of the strike. Was the target destroyed? Purpose. The goal is to make this chain as fast and automated as possible, minimizing the time from detection to destruction. Palantir and kill chain. Palantir and similar companies build software to speed up and automate parts of the kill chain, integrating intelligence, surveillance, and targeting data for militaries. For example, integrating satellite images, drone feeds, and sensor data so analysts or autonomous systems can quickly move through the find, fix, track, target, engage, assess loop. What data did the Gotham kill chain collect and make decisions on about you during COVID-19? Your name, date of birth, gender, race, home address, phone number, email, occupation, employer, health and medical data, PCR test results, DNA, antigen, antibody, vaccination status, vaccine type with its lot or batch number, date and location of vaccination, symptom tracking and self-reported illness, medical history, underlying health conditions, comorbidities, hospital admissions and discharge data, ICU and ventilator usage, mortality data, cause of death, date, location, contact tracing data, names and contact details of recent close contacts, locations visited, work, home, public places, time and duration of exposure to infected individuals, mobility and location data, cell phone GPS location data, anonymized in some cases, most cases individually tracked, public transportation usage, movement between regions, states or countries, travel logs, workplace and social data, workplace outbreaks, where, how many affected, school attendance and exposures, participation in large gatherings, events, healthcare system data, hospital and ER capacity and occupancy, PPE and medical supply inventory, staff, illness and vaccination status, testing and vaccination logistics, testing appointment booking info, including ID details, vaccination site scheduling and confirmation, batch numbers of vaccines received, genomic and epidemiological data, viral genome sequencing, aggregated data on spread, infection rates, and clusters. You may be asking, how is any of this legal? Well, HIPAA is how. HIPAA was never about protecting your medical privacy. In fact, it is the exact opposite of what you thought you were signing. The HIPAA form was to trick you into giving your full consent for 2.2 million corporate, government, and private entities, granting them full access to all your medical records. Didn't you ever question, How does this new doctor in this new hospital in this new city have my medical history from my old doctor from a previous city and completely different hospital chain? HIPAA is how.
Getting wealthy off of killing Palestinians. Palantir kills Palestinians with their AI and technology.
Oh.
Killing my family in Palestine.
Yeah. And, you know,
What kind of person are you? How do you sleep at night?
well, if you,
Shame on you.
do you want to hear my answer? So the primary source of death in Palestine is the fact that Hamas has realized that there are millions and millions of useful idiots that will...
Stop using that excuse. This is why you don't get left. How dare you? Your AI and your technology from Palantir kills Palestinians.
mostly terrorists.
So what do you think about the use of artificial intelligence or lavender by the IDF in identifying Hamas targets?
Look, I'm not, without going into all the I'm not on top of all the details of what's going on in Israel because my bias is to defer to Israel. It's not for us to second guess everything, and I believe that broadly the IDF gets to decide what it wants to do, and that they're broadly in the right.
We're doing it, and I'm sure you're enjoying this as much as I am.
Or the burden of explaining to your friends that you're really happy. Maybe we should just stop talking about it. I'm very happy to have you along for the journey, and you are partners for us. Every Palantirian, we are crushing it. Everyone else who's listening, we are dedicating our company. We've dedicated our company to the service of the West and the United States of America. We're super proud of the role we play, especially in places we can't talk about. And we love our success when it's necessary to scare enemies and on occasion kill them. And we hope you're in favor of that. I hope you're enjoying being a partner, and we're really happy and very, very focused on what we're doing.
The more you bleed, the more money